Endoscopic ultrasound-guided drainage of pancreatic walled-off necrosis using 20 mm versus 15 mm lumen-apposing metal stents, an international multicenter case-match study. Introduction. Endoscopic ultrasound, EUS-guided, transluminal drainage has evolved to become the treatment of choice for symptomatic pancreatic walled-off necrosis, WON, with higher efficacy and fewer adverse events compared with surgery and percutaneous drainage. Traditionally, EUS-guided WON drainage was performed with placement of multiple plastic stents, or biliary or esophageal fully covered self-expandable metal stent. However, these stents have several design deficiencies that result in a high rate of stent migration, occlusion, and inability to perform direct endoscopic necrosectomy, DEN, without stent removal. Lumen-apposing metal stents, LAMS, are specifically designed for the drainage of pancreatic fluid collections. The wider luminal diameter of the LAMS facilitates drainage of WON contents and allows DEN through the stent. The bilateral dumbbell-shaped flanges reduce the risk of migration and leakage by holding two lumens in apposition. In addition, the easy deployment system results in a high technical success rate. Several studies have demonstrated high rates of technical, 92.8% to 100%, and clinical success, 81.0% to 97.6%, for EUS-guided WON drainage using LAMS. Until recently, only LAMS with diameters of 10 mm and 15 mm were available. The 20 mm LAMS was recently released on the market. Its wider luminal diameter provides 300% and 78% greater cross-sectional area compared with the 10 mm and 15 mm LAMS respectively. Therefore, it is plausible that the 20 mm LAMS allows enhanced WON drainage and DEN, resulting in higher overall efficacy of WON resolution compared with the 15 mm LAMS. Nonetheless, the larger flanges may theoretically increase the risk of adverse events. Currently, the safety and efficacy of the 20 mm LAMS is not known. In addition, it is unclear how the 20 mm and 15 mm LAMS compare in terms of efficacy and safety. The aim of this study was to evaluate the efficacy and safety of the 20 mm LAMS and compare them with the 15 mm LAMS for the treatment of WON. Background. Endoscopic ultrasound, EUS-guided placement of lumen-apposing metal stents, LAMS, has gained popularity for the treatment of pancreatic walled-off necrosis, WON. Parsa et al. Compared the 20 mm and 15 mm LAMS for the treatment of symptomatic WON in terms of clinical success and adverse events. Methods. The authors conducted a retrospective case-match study of 306 adults at 22 tertiary centers from April 2014 to October 2018. A total of 102 patients with symptomatic WON who underwent drainage with 20 mm LAMS cases, and 204 patients who underwent drainage with 15 mm LAMS controls were matched by age, sex, and drainage approach. Conditional logistic regression analysis was performed to compare clinical success, resolution of WON on follow-up imaging without reintervention, and adverse events according to American Society for Gastrointestinal Endoscopy criteria. Results. Clinical success was achieved in 92.2% of patients with 20 mm LAMS and 91.7% of patients with 15 mm LAMS. Odds ratio 0.92, p equals 0.91. Patients with 20 mm LAMS underwent fewer direct endoscopic necrosectomy, DEN, sessions. Mean 1.3 versus 2.1, p less than 0.001, despite having larger WON collections. Transverse axis 118.2 versus 101.9 millimeters, p equals 0.003. Antero-posterior axis 95.9 versus 80.1 millimeters, p equals 0.01. There was no difference in overall adverse events, 21.6% versus 15.2%, p equals 0.72, and bleeding events, 4.9% versus 3.4%, p equals 0.54, between the 20 mm and 15 mm LAMS groups respectively. Conclusion. The 20 mm LAMS showed comparable clinical success and safety profile to the 15 mm LAMS, with the need for fewer DEN sessions for WON resolution.